for all medical orders, they need a physician's signature. And I work as a primary care, pediatrician in complex care. So I often do get the orders. And so, our flow has been, making sure that our nurse goes over the orders and the medications first, then I review them. And if there's something that doesn't, sound right or doesn't, isn't consistent with what the other specialist has recommended, then we will, try to modify that and speak to the nursing agency. I think for the families, I often encourage them also to do a lot of review and education with their nurses, because again, there's turnover, there's change in shift, right? There's new people always coming in and out. And so I always encourage them to really, go over the regimen, what their child prefers, like what's the best way to do, certain things, because some of those nuances aren't always communicated on the order itself.
What about orders for life-sustaining treatment? Do you have conversations about that, about those?
I think, for the patients in hospice, definitely. For other patients, I think depending on the circumstances, yes, right? So, even if the family has not or does not elect to be under hospice care, but has, very high potential for a life-threatening situation come up, we make sure that's clear on the nursing orders. I think it's been a challenge, again, trying to talk to individual nurses because that group, for the family is always changing, right? And so we would like to, right, for some of our families who've been very involved, we've had group nurse meeting, meeting with all their nurses like once a week. But it's time consuming and it requires a commitment from everybody wanting to do that. But I think that's the ideal, that we all communicate as much as possible, including, whoever is sort of the medical home provider for the child.